Welcome to Evergreen Family Medicine. Today we're with the CEO of Evergreen, Dr. Tim Powell, and the topic is Medicare. Not just Medicare, Medicare choices, Dr. Powell. Why is it important we mention choices when it comes to Medicare?
Well, this is an important time for Medicare choices, Brian. Between October the 15th and December the 7th is when folks can, through open enrollment, change the Medicare plan that they are in. So seniors are faced with a decision. Do they keep their current plan or do they make a change to one that may be less expensive or even offer more services?
This is a conversation you have had many, many times.
Oh, have I ever? You know, Brian, you would think that Medicare would be simple. You sign up for it and you get Medicare. You would be so wrong. This is a decision I must have had a million times through my time of practice with my patients. And of course, in that office visit circumstance, I really didn't have the time to dig into this as it really merited. So I appreciate this time with you to make a video and to kind of explain why it's important.
So are the standards different? It feels like almost every situation is unique, every person's unique, and that may be why there are so many choices, but it's too bad there isn't just one standard.
People think, well, I'll just sign up for Medicare, and whatever Medicare allows, Medicare, that's what I get. And unfortunately, too many people stop there, and they do it to their own detriment. So let me explain. I'm 70 years old now. I've been on Medicare for 5 years. I'm one of these old guys we're talking about. And when I signed up for Medicare, I signed up for Medicare Part A, and that takes care of hospital bills. And then I signed up for Medicare Part B. And Medicare Part B takes care of the office visits and the outpatient things. Now the fun is just starting, because then I said, well, I should probably have a Medicare supplement. A Medicare supplement, a lot of people believe, well, I should get that because that takes care of what Medicare doesn't. That is wrong. What a Medicare supplement takes care of is the difference between what Medicare allows and Medicare pays, which is to say, if Medicare does not allow whatever service, for example, a routine physical. Medicare doesn't cover routine physicals. And if it doesn't cover, neither will your GAP or your supplemental insurance. So I went shopping for Medicare supplements. Go online and look at that. There are 10 different kinds of Medicare supplement plans. Now, there is an infinite number of people that sell them, all at different costs and considerations, but there's 10 different plans which pay more or less of what Medicare doesn't. You think then that you kind of have this figured out, but what you need to understand is Medicare supplements are expensive. I see myself as healthy, but for myself and my wife, and we're both very fortunate in terms of our health, the cost of that Medicare supplement is $3,000 a year. $3,000 a year. Now, that's in addition to paying for Medicare as well. And you, again, go through the calculations in your mind. You say, yes, but I'm being covered for what Medicare doesn't. Isn't that a good deal? It really depends then on your situation. If I was in the hospital a lot with a lot of hospital deductibles, it might pay. But for my situation specifically, I usually go into the doctor once a year. And just say the bill for that, just to use an example, was $100. Medicare pays $80, so your Medicare supplement pays $20. So between my wife and I, we both go in once a year. They pay $40 and we pay them $3,000. A lot of people are utterly being hosed by a Medicare supplement. Then you go to Part D, because the individual also needs drug coverage. Too many seniors will look at their situation at age 65 and say, I'm pretty healthy. I really don't take many medications. I think I'll just avoid Part D. Bad decision. Because if you then, in later years, now you have heart disease or cancer or diabetes or whatever it is that you need, and the drugs are very expensive. If you sign up later, you're greatly penalized in what it costs for that Part D insurance. But go shopping for Part D. There's an infinite number of them to choose from as well, and what they cover, which formulary is there. And so it's incredibly complex with that. And one way of trying to simplify that is through a Medicare Advantage insurance, which can be thought of possibly as a simplified all-in-one insurance policy. But just like what I was speaking about with supplements and Part D, there are a ton of Medicare Advantage, and a few of them are very good, and a lot of them are terrible.
You just went through a 30,000-foot view of Medicare, and I was able to follow that. Thank you for that explanation. But what's it like when you start talking to a patient sometimes who's getting either already at 65 or a little bit later on in life, and boy, some of this just starts to turn to mush as you're explaining it. Can you talk about the challenge of just understanding everything that you just described in such an important decision?
Well, that's an incredibly important point, because in essence, if they were just to try to figure this out on their own, or I was trying to explain all this in 10 minutes in the office, I would do them a terrible disservice. The best plan depends so much on their individual circumstance, what diagnosis they have, the type of care, how much travel they do, what medications they're on. And so as we are now, as Evergreen Family Medicine, really try to guide and help our patients make the decisions that then help us take better care of them, we are guiding them to very reputable, ethical, independent insurance agents. One thing I need to say to folks that are listening to this, Brian, and this is so critical, if you go on our website and you'll look at the individuals we have listed there, those people are available to spend all the time it takes with you to help you come to the best plan for you at absolutely no charge. Zero. No charge. They're paid by the insurance company, but the good ones are not tied to just a few products. They're ready to really understand, first of all, what's better in your area. If you're in Southern California or Coeur d'Alene, Idaho, the best choice may not be what it is in Roseburg, Oregon. So they understand which insurance plans are actually being accepted. And that may shock some of the folks. You mean some practices, actually most practices in Roseburg either limit or will not take Medicare because of the poor financial reimbursement or all the regulations around it. Evergreen has no restrictions that way, but we are trying to guide our patients into the best decision that fits their circumstance.
You've partially answered the question, but why is Evergreen taking such a lead role right here with its patients?
For so many years, I would be in that situation with that patient, and I would describe an incredibly complex decision-making matrix, but I had no way to actually control what that patient was offered, to have input into that. Now Evergreen has spent a lot of time talking to a select number of Medicare Advantage companies and specifically negotiating the best value for our patients. We are contracted this year with Regence Blue Cross, MODA, HealthNet, Atria, and a new company this year that we're really excited to work with is Pacific Source. All of these offer a Medicare Advantage product that we're proud to introduce to our patients. What this does, first and foremost, Brian, this is incredibly important to us, is it allows us to do what Medicare does not, and that is to provide a very comprehensive physical exam on an annual basis at no cost no cost to the patient. And this helps us actually take better care of the patient. It also helps the insurance company because they get full information about all the conditions that patient has. And it really helps the patient because we have the time to really bring everything together. And when anything raises its head throughout the rest of the year, all of my staff refer back to that annual physical to see what was the plan. Where were we going? Where was this? And what was the intention? And it really provides the hub of the wheel to take better care of people.
Yeah, and we've talked about that as well. When you get that phone call and they want to check up on you and Medicare is asking these questions, it's so important to answer well, get in there, get your appointment, have Medicare pay it, stay current.
Just to distinguish, because this is really important as well, we've talked about annual wellness visits, and annual wellness visits are important. They take care of all the preventative care. Have you had your hepatitis C? Have you had your colonoscopy? Are you up to date on your shingles vaccination? Whatever it is. And so they address that. However, no actual physical exam or diagnostic exam is able to take place. It's actually prohibited. No hands-on. And so this is very different within the Medicare Advantage and why it's separate from Medicare and why I think for my patients it's a better value. Almost always it'll be much less cost as well to my patient, but that's lesser the reason that I'm actually able to take better care of them with this. I can do a physical exam with the companies that we're working with, their software that sort through all of their previous record. They bring out or extract every diagnosis ever applied. We look at every one of those, try to refine those to their highest degree and understand exactly where the patient is in terms of their health risk and to develop a plan. And so when now we're able to work with companies, not just to provide their needs of having a health risk assessment, but to use that time to really provide good care to the patient. Now we're, instead of being the tail, we're a little bit the dog. And we're beginning to actually change the plans that are available to our patient and provide better care.
So talk about some of the problems patients covered by Medicare might face.
A lot of people have misunderstandings about Medicare. First of all, in just understanding the process of choosing. Perhaps they have atrial fibrillation and they really should be on Eliquis instead of Coumadin, but they can't afford that. Well, they need to sign up for a plan that does cover the Eliquis so they can get the best care they need. That's how the type of plan actually impacts the care that we need. A lot of times they don't really look at it and say, can I use this plan elsewhere? I like to travel, I like to go south. Is this sort of things covered? The third thing is this, Brian. A lot of my seniors are on very fixed income. And so they don't have a lot to spend. They frankly can't afford that Medigap or that Medicare supplement insurance. They are paying for it, but are getting very little from. And they would be much better served by another plan, but they don't understand it, so they're kind of frozen in place a little bit. And the fourth thing is this, there are a lot of garbage Medicare Advantage plans out there as well, so you really have to know what you're doing when you choose one, and choose one that's going to be respected in your local area, because frankly access to care is one of the bigger issues my seniors are facing.
So it's very important for seniors to have trustworthy information to make this choice. Where do you suggest they go?
I would like to ask them to go to our website, Evergreen Family Medicine, and look at the resources. We have a lot of resources there. Included in those resources are the group of local independent insurance agents that we very carefully vetted. These are ethical people. They really know their craft. They're dedicated to their patients and will take good care of you. And it will be at no cost to the patient. You have nothing to lose. You can still stay with the one you're on. But for so many of you that are on just regular Medicare and a Medicare supplement, I'm telling you, you can do better.
Well, thank you very much for all of this information. like we said before, as you go through all of that, it's good probably to have another set of ears and eyes as well as you go through this. I mean, if you have a family member that can sit with you, a son or daughter or somebody who you trust.
They really should. It's so much to take in, Brian, in your spouse or a son and daughter to really understand the options. Yeah.
Well, once again, thank you, Dr. Powell. So much good information there. Make sure that you know enrollment goes from October 15th to December 7th, and make sure you stop by at evergreenfamilymedicine.com to find out more and to see all those resources that we just talked about. You can also follow Evergreen Family Medicine on Facebook, YouTube, Twitter, and Instagram.